Hello, welcome to Health Talk with Dr. Toying. Today we'll be discussing constipation. Constipation is when an individual is opening their bowels less than what is expected for that individual. Although medically speaking, it is the opening of bowels less than twice a week. But constipation is actually relative to the individual. This is because some individuals open their bowels 3 times a day, while some 3 times a week. So if you notice you're opening your bowels less than what is expected for you, that is constipation for you. We'll look at what is called the Bristol Stool Chart to better understand normal bowels. The Bristol Stool Chart is used to describe the consistency of stool or feces or poo, whichever way you would like to call it. Type 1 stool presents as separate hard lumps, or it looks like rabbit droppings. This indicates severe constipation. Type 2 stool is lumpy and sausage-like, and some people have described it as a bunch of grapes. This indicates mild constipation. Type 3 stool is sausage-like with cracks on the surface, and some people have described it as being like corn on the cob. This is normal stool. Type 4 stool looks like sausage and is smooth, and this is also normal. Type 5 stool looks like soft blobs with clear-cut edges, and some people say it looks like chicken nuggets. Although this is normal, it seems like the person is lacking fiber. Type 6 stool is mushy with ragged edges, and it looks like porridge. This indicates mild diarrhea. Type 7 stool looks like gravy, liquid, and no solids in between. This indicates severe diarrhea. Types 3 to 5 are considered as normal stool. Constipation is when hard stool is passed. Sometimes when you do get constipation, you tend to get what you think is diarrhea. But what actually happens is the bowels are a tube, and when feces gets stuck in the tube, the outer portion now dissolves in quotes, and that is passed out. And some individuals will think that is diarrhea, but it is actually what is called overflow, fecal overflow, and it's just the outer portions that are melting in quotes. This is common in the elderly. People that are prone to constipation are those with poor diet, those that do not eat enough roughages, or those that don't drink enough water for the stool to be soft enough to be passed out. Pregnant women are prone to constipation. There are some medications like codeine that predispose to constipation. Those that are immobile, like after surgery or during illness, this can predispose to constipation. The elderly, like I said earlier, are also prone to constipation. If you do notice you're opening your bowels less frequently, and this has been going on for more than 6 weeks, you do need to see a medical practitioner, as it might be something serious. Other causes of constipation include what is called irritable bowel syndrome, or even stress that can lead to a change in bowel opening. Some other conditions, like what is commonly known as piles, or even when you have a cut in your anal region, which is known as a fissure, can lead to constipation. Those conditions sometimes have blood mixed with stool. But in any of these conditions, if you're worried, please seek the advice of a medical practitioner. To help with constipation, you need a good diet that includes roughages, so your bowels can open regularly. Avoid too much of processed foods, because that slows down the bowels. A good water intake is encouraged. If it's really severe, some laxatives might need to be used to help with bowel opening, but it's advised not to use this for a long time. But short-term treatment can be good for relief. If there is impaction of feces, a suppository might need to be used, which is inserted in the back passage to help to decompress, in quotes, the bowels. And as said earlier, if this has been happening for up to 6 weeks, it would be good to seek the advice of a medical practitioner. If you are worried at any time, do still seek the advice of a medical practitioner. I hope you enjoyed this video. Don't forget to subscribe to my channel, share this video, and until next time, smile because it's healthy. Bye.